co-sponsor Debbie Dingell from the state of Michigan, and to say that we are joined today also by a number of our members of Congress colleagues who have been fierce champions and some who have to speak quickly and get back to the Ways and Means Committee. We are at this historic moment where today, for the first time in the history of the House of Representatives, we are having a hearing on Medicare for All in the Ways and Means Committee of the United States Congress. And that is because of you all. And I just want to say thank you so much. We will name all the groups as soon as we get through, everybody. But I want to say thank you so much. CPD, National Nurses United, Public Citizen, Social Security Works. I'm missing some other ones. Our Revolution. Everybody that has been out there fighting to make this real. What we heard in the Ways and Means Committee today, just as we heard in the previous two hearings that we had, is that healthcare is a human right. That Medicare for All means everybody in and nobody out. And that we are making tremendous progress. We have 113 co-sponsors of the bill. We are set to add a couple more soon. And we have had letters from 200 economists. We have had a business coalition come forward with their support, and we have some incredible champions in the Ways and Means Committee that you'll hear from. With that, let me just quickly, because I want to get to the Ways and Means folks, I'm going to keep my comments short. Let me just introduce my good friend, a champion on healthcare for so long, a champion for people across this country making a better life and demanding healthcare, Debbie Dingell from the state of Michigan.
I'm going to be really short because I want you to hear. I am really short, but I want you to hear. I want to thank Pramila for her leadership, but I want you to hear from the Ways and Means Committee members who today, because of them, we're taking another step forward. I wanted to use the words that President Obama used when he was talking about the man that I love. When he said, by the way, everybody here knows that the first universal health care bill was introduced in the early 40s by my father-in-law. And then every session of Congress, starting in 1955, John Dingell introduced universal health care because he, like me and his father, believes that every American has a right to affordable, quality health care, period. And it takes time, and that's the quote I'm about to read. But remember, we got Medicare in 1965. We got the CHIP, the Children's Health Insurance. And President Obama, when they signed the Affordable Care Act, he reminded us, change takes time. It takes courage. It takes persistence. But if we push hard enough and long enough, change is possible. Today, because of the Ways and Means Committee, change is in sight. And it's here. We're going to stay at the grass. We love the groups, but it's happening in community after community after community because people are scared. They can't afford their medicine. They're paying too much in out-of-pocket expenses. So I now want you to hear from the Ways and Means Committee, which had the balls to have the hearing today. Yay! So my colleague, Earl Blumenauer, who is a wonderful friend, and we'll go on down from there. But Earl, thank you for all you do on so many things.
We'll go on down from here. Thanks, Debbie. Thank you. Thank you for giving us a sense of the lineage here, and for you two providing individual leadership. We had a historic hearing before Ways and Means. But what I found, and we've done these events in my district, hearing from not just the grassroots, but hearing from people in the healthcare profession, people in government, what we are finding now is that people are already paying the price.
That's right.
They get sick more often.
That's right.
They take longer to get well. And for the privilege, we pay more than any country in the world, usually by a factor of 2.
That's right.
And we die sooner.
That's right.
It doesn't have to be this way. And the hearing today gives us an opportunity to delve into the facts. And the deeper people go, understanding the dynamics of our hopelessly complex healthcare system now, is that this is a possibility. This is an imperative, and this is what the public wants. And working together, it's not going to happen overnight, but we're on a path for universal health care, brushing aside the lame excuses that some of my Republican friends started to trot out. But if we stay focused, we stay committed, we stay with the facts, we stay with the people, we're going to win. Thank you very much.
And now from California, another Ways and Means Committee member, Jimmy Gomez, and a co-sponsor of Medicare for All.
Thank you so much. First, let me thank these two amazing leaders for getting us to this point. I want to let you know that healthcare is a personal issue for me, just like millions of Americans. You know, I grew up without health insurance, and anytime I would get sick or injured, my parents had to hold their breath that we didn't end up in the emergency room. Because if we end up in the emergency room, anything could happen. So I was one of the folks that actually did end up in the emergency with pneumonia when I was 7 years old. And that 1 week stay in the hospital almost bankrupted my family from lost wages and hospital bills that were piling up. You know what? No parent should have to worry that if their kid gets sick, do we delay care? All right? That is not right. And even with the Affordable Care Act, which is a huge leap forward, it's still not right. You know, there is a young woman, her name is Jeanette Acosta. She was a constituent of mine, and she was a friend, somebody I actually met. She knew something was wrong and tried to go and see her doctor. She had health insurance. She tried to go and see her doctor to get an exam, a cervical exam. Couldn't get in. So she had to turn to Planned Parenthood to get in immediately. But then she got the unfortunate news that she had stage 4 cervical cancer. And she passed away about a year later. So anybody says that, oh yeah, you have access to care, tell them that all access is not equal in the United States of America. Right? So we need to push these ideas, the idea that everybody has access to real care, and that your outcome should not be determined by the color of your skin or by the zip code you live in. Right? And that's what we're working for. You know, and I hear these people say, you know, when you present a new idea like Medicare for All, which has been around for a long time, people think you're crazy. Then eventually they say, okay, maybe it's still a radical idea, but you can't get there. But eventually it becomes an idea in the mainstream. And this hearing today is saying that the idea of Medicare for All is approaching the mainstream for the first time in a long time. So I'm going to go and testify in support, and I want you to know that we wouldn't be here if it wasn't for all you. So thank you so much.
And I want to call up, we have one more Ways and Means Committee member who has to go back and do his questioning. So let me ask you to come up, a tremendous supporter of Medicare for All, actually for a long time, Brendan Boyle from the great state of Pennsylvania.
Well, thank you. And as Pramila mentioned, I literally am up in about 15 minutes or so we'll have to run back. But I just wanted to be here more than anything to say thank you. Also, forgive me, I've been sitting through listening to Republican talking points for the last 2.5 hours, so I have a few things I want to get off my chest. First, the more things change, the more they stay the same. Half a century ago, when Medicare came into existence, and that was the big political fight, you heard exactly the same garbage that you've been hearing from some for the last 2.5 hours. Socialized medicine. Socialism, Soviet-style healthcare. They at least haven't used that one in this hearing, but we still got about an hour and a half to go, so we'll see. Folks, this is nonsense. Healthcare is a universal human right, period. And that's not just me saying it. That's not just some of my colleagues saying it. That's not just you saying it. That is what the United States signed up to more than 7 decades ago in the UN Human Rights Declaration. It is right there. So the United States has already committed itself to that. So what we are doing here today is actually not radical. It's common sense. And I'll share with you, I'm very proud to be from Philadelphia, and as one of the older cities, you sometimes, in walking around some of our older buildings, see a little plaque on old Philadelphia townhomes. I see some of them actually here in Washington as well. And it's a little plaque that's actually built into the house, and it looks like a fire engine, or it's something denoting firefighter. And it looks historical, and you might wonder what that is. Well, back a couple centuries ago, people had to have insurance in order to pay for firefighters to put out a fire in their house. Fires were much more common then, unfortunately. So literally, if firefighters came and they didn't see that plaque on your house, they wouldn't do anything. They wouldn't put out the fire. Now, we look at that today and say, my God, that was barbaric. Americans, decades and centuries from now, will look back at this time and say, you mean there was a time when millions of people would just be allowed to die because they didn't have health care? That is the way future generations will look back upon the system we have now. So look, right before the onset of the Affordable Care Act, and right as the Great Recession was taking hold, we hit the 50 million mark in terms of those uninsured. Thanks to the ACA, that figure has dropped almost in half. It's approaching 30 million. It's unfortunately been creeping up the last couple of years. Essentially, the Affordable Care Act cut in half the number of uninsured. However, we still have upwards of 30 million people who lack health insurance in the wealthiest country in the world. And you're right, that doesn't even include all the millions who are underinsured. So this is, in my view, and I share this with Pramila, I don't know when, I really look at this issue as the unfinished business of the New Deal. It is now time in this generation to complete the mission and make sure every single American living in the wealthiest country in the world has the basic human right of health care protected. Thank you.
Thank you so much.
Thanks for everything you're doing.
Thank you. Okay, well, that was great to be able to get some Ways and Means folks in. We weren't sure that was going to be able to happen, but now we get to go back to our original program, and we are so proud to have with us one of our true champions, somebody who inspired me to run for office, somebody who is a leader in the Democratic caucus, and one of the founders and former leaders of the Congressional Progressive Caucus, somebody who's been fighting for racial justice and racial equity her whole life. And really understands why this issue is so important, Congresswoman Barbara Lee.
Thank you. First of all, thank all of you for beating that drum and for, as we say in my district, staying woke. Thank you. Let me thank Congresswoman Dingell and Jayapal for pulling us all together, but also for your steady hard work and fight for Medicare for all, because this is a major deal to get a hearing now before the Ways and Means Committee. We had one in budget. And Pramila, I just have to say, what do you have, over 100 co-sponsors now? I remember
113.
113. Okay, give Pramila a round of applause, because I remember when we were talking about how to get to 30, to 40. And so I think our time has come. Time has come. Just a couple of things. First of all, healthcare should not have a profit motive, because it is a human right, right? Secondly, let me just say, I lived in England for 2 years. I know the difference. I understand what access means, a quality health care without having to worry about how you're going to pay for your premiums or your health care. I introduced the first single-payer bill in the state of California in the legislature in the mid-'90s. And I did that, in the mid-'90s, because I knew then that this day would come. And so I just have to say to you, thank you all for being here, for your work, because yes, in the richest country on earth, no one, and I mean no one, should be denied health care. When you talk about racial equity and health disparities, we've been working on this for years, trying to close the gaps, and they're huge gaps with people of color in health care. And Medicare for all will put us on the path to ensure that there's equal access to quality health care for everyone, regardless of their zip code, their background, or whomever they are. And so finally, it's just so important that this drumbeat continue, because we've seen the progress, Pramila and Debbie, since this January in how this has moved. And so to all of you, I just want to salute you, because we couldn't make this progress without you out there pushing this and being the public organizing the wind beneath our wings to get us to this point. So this day is going to come where we're going to have Medicare for all in this great country. So thank you again. Thank you guys, and congratulations. And then as an appropriator, I'll be able to appropriate the funds.
Okay, we have two amazing vice chairs of the Medicare for All caucus that Debbie and I and Keith Ellison, when he was here, established last year. And they have been champions on a whole host of issues. They are new members, but they are, I'll tell you what, lighten the place up in all kinds of ways. Some of you may have seen Joe Neguse testifying on the House floor on opposing the Republican motion to recommit on the Dream and Promise Act. And I am just so grateful to have both of them here today. Joe Neguse from Colorado and Ilhan Omar from Minnesota.
Well, thank you, Jayapal, and thank you all for being here. It is true. This is not a radical idea. This is a common sense idea. But really, there's nothing wrong in being radical, because I think we all believe in radical love. And it's radical love that brings us here. So I'm so proud to be here today. It's amazing to see that we're getting the third hearing, and that the Ways and Means Committee is holding its first hearing for Medicare for All. This is a historic step in the process of recognizing that healthcare is a human right, and everyone in this country deserves to have their basic needs met. It's unacceptable that millions of people are unable to seek care because they live without or cannot afford insurance. Millions of adults in the United States still do not have health insurance. 1 in 4 Americans cannot afford or access the health care they need because of prohibitive costs. Medicare for All would end this. And here's what Medicare for All really means. I know that you probably heard this from Jayapal earlier, so I'll restate it again. It means high quality health care for U.S. residents. Comprehensive coverage, including dental, vision, and long-term care. This is historic. It has not been proposed before. No co-pays, deductibles, or other cost sharing. Substantive administrative savings through global budgeting of hospitals. An end to profiteering by converting for-profit insurance to non-profit status. And a more efficient healthcare system by cutting out private insurance companies' middlemen. No one should be benefiting from sickness. We have heard this criticisms. First, they said it was not popular. That's not true. Because we know that Medicare for All is supported by 70% of Americans. That is more than half, if you do the math. They said it's not a progressive idea. It's not a Democratic caucus idea. It's not an idea that solves one of the greatest problems we have in this country. They said we couldn't afford it. Well, guess what? We do not suffer from scarcity in this country. We suffer from greed. We are one of the wealthiest nations in the world. The richest 2,000 families have over 4 trillion in wealth in this country. So there is no shame. There is no reason why in 2019 in the United States of America that people should die because they couldn't afford a doctor's visit. Make no mistake. Like my colleague said from Pennsylvania, history is on our side. Economics is on our side. And the American people are on our side. It's time that the United States joins every other industrialized country in the world and once and for all guarantees every single American the basic right to health care. I cannot wait to see your vision and your vision come to light.
Our vision.
And more importantly, this is what happens when we organize for what the America we deserve. The progress from having 1 or 2 or 3 to praying for 30 to now having 113 happened because all of you organized to make sure that we had people who had a moral courage to push for progress. This is progress. This is the America we deserve, and we're organizing for it. Thank you.
I'm going to go fast because we've got to go vote. I will just say, I don't know that I could say it any better than my colleague, Representative Omar. Both Ilhan and I are new to Congress. We've only been here for about 6 months, but we've certainly been here long enough to know that what is happening with respect to this bill is a big deal. It is a big deal to have 113 co-sponsors on any piece of legislation. That's almost half of the Democratic caucus. It is a big deal to have 3 hearings in 30 days. It is a big deal to have a hearing before the Ways and Means Committee. And, I want to say thank you to Representative Jayapal and Representative Dingell, because this doesn't happen overnight. It only happens because good people show leadership when it is needed most. And both of you have led the charge and have been beating the drum along with this army behind us and countless others across the country. And the results are soon to be delivered in this Congress, I believe. And at the end of the day, this will have real consequences for a whole lot of people. Certainly back in my district in Colorado, where there are 90,000 people who are still uninsured and countless more who are underinsured. Folks who are paying more for their health care premiums than they are for their mortgage. And so to those who say that we can't afford a Medicare for All system, I would say we can't afford to let another family go bankrupt if, God forbid, a loved one gets sick. That, for me, is what this debate is about. So the momentum is on our side. We're going to keep pushing, and we know that you all will too, right? Yes. Thank you all so much. Appreciate it.
Thank you. Excellent. So we are incredibly fortunate to have with us so many advocates who have just been pushing and pushing and pushing, and none of this would be possible without you. You know, they said we couldn't get 1 hearing. We've had 3, and it's because of the organizing on the ground. So let me introduce now from our revolution, Roxana Segovia Beltran, to come up and talk with us. Oh, there you are. Okay, good. Wonderful.
Hi, thank you for having me. My name is Roxana, and I'm from Our Revolution, Howard County. We've been working a canvas, knocking on doors, and, they told me they wanted a story, so here's mine. I'm originally from Southern California, and I came from this awkward income level where we couldn't afford health insurance, but we didn't qualify for Medicaid, so our option was nothing. So when you're a child being raised in this situation, as one of the congresspeople said, you kind of have to do this wait and see approach, right? Let's just wait and see our kids don't get sick. So I got lucky. I didn't get sick as a child, but my time ran out when I was in college. So I ate some bad fish, having no idea, and I was with this itchy throat, and I was about to graduate, and I had debt, but I was like, I need to just not worry about this, right? I can't worry about an itchy throat right now. My throat starts closing up, and my boyfriend, now husband, says, I think you should go to the hospital. And I said, I don't think I could afford that. I have debt coming up in about 6 months. I can't go to the hospital. I'm just going to go to sleep and hope I wake up. So they took me kicking and screaming. I show up and I say, I don't need to be here. Like, can I just leave real quick? Like, there's more people sick than me. They said, oh, you can't breathe. That's a problem. And I'm like, oh, okay. So they give me my epinephrine, and they say, wow, we saved your life. And this whole time they're talking about my life, all I could think about is the debt. What am I going to do with this debt? I don't have mommy and daddy to pay for my debt. No one's going to pay for this. I have to pay for this. And it's 2010, and we're in a recession. So I call the hospital. What do they say? Well, you can do payment plans, but you're still going to go to collections. It's like, okay, great. So I'm going to go bankrupt before 30? So my choice was, the choice that many people have at this point is my credit card, my handy-dandy credit card, right? 20% interest, took me 6 years to pay that off, right? But the thing is that I'm the lucky one because I'm still here, that's right? The people that die are the ones that really have suffered, right? And their families, because we've had that situation in my family. Walk into the ER, stomach not feeling good. Oh, you have cancer. Well, essentially, if you came a year ago, you probably wouldn't have died, but now you have 3 weeks to live. That's a story in my family. So the last thing I want to talk about is being not insured and being underinsured. There's a very fine line between that. I have insurance now, but quite frankly, it doesn't feel that different. Yes, I can take my kids to the doctor, and I'm so grateful for that because we never did that. But $10,000 deductible, what is that? Like next year, another accident, another $10,000, what are we going to do here? That's right. This is not an option because they're profiteering off of our lives, of our pain and our death, and that's why I support Medicare for all.
Everybody in? Nobody out! Everybody in? Nobody out! Everybody in? Nobody out! Everybody in? Nobody out! All right. Thank you so much. We have about 2 minutes for any questions that reporters might have. And then what I really need is for everybody to go back to the Ways and Means hearing room because we want to make sure that hearing room is packed. There are some people that are still left to testify that could really use seeing you in the audience. And you will help give courage to those that aren't yet on the bill to continue to to continue to see the support that there is. So any quick questions from reporters? Yes.
Representative Jayapal, one of the major criticisms from Republicans in the hearing was that people would lose their corporate or private insurance. Could you explain how the benefits of Medicare for all are more expensive than what private insurance currently offers?
Well, what the question is about private insurance, and let me just be very clear about something. Medicare for All proposes a comprehensive set of benefits that do not currently exist. Today, if you want to get mental health, if you want to get vision, dental, you have to buy separate coverage, even if you're already covered by Medicare. So this is an expanded and improved Medicare for All that provides reproductive care, that provides mental health, vision, dental, all of the care that you need so that you don't get sick, and if you do get sick, you get the care. Then what we do, and a lot of that care is being covered by private insurers who charge a lot of money for those plans. We have incorporated those benefits into Medicare for All, and then we have said that no, if you're a private insurance company, for-profit insurance company, you cannot offer the same benefit, right? So it is going to limit the role of private insurance companies. Now, we're not banning them from existing. They can continue to exist. If they want to provide a benefit for cosmetic care or something else, they can do that. But they can't provide the same benefit and charge a lot of money for it because our belief is that healthcare is not a profit-making industry. It should be, we should be able to get a guaranteed insurance program so that people don't have to rely on GoFundMe for their insurance plan. Thank you all so much. I got to run for votes, but thank you for being here. Let's go back to the hearing. Let's continue to show our support. Thank you so much. Nobody out! Everybody in! Nobody out! Everybody in! Nobody out! Everybody in! Nobody out!
Good job with that lead there. Great job, team.